and there were multiple presentations on cardiac involvement in Fabry disease. So the first thing is we know that patients with Fabry disease may have a comorbidity of hypertension, or we may see hypertension is more often in Fabry disease. So the Brazilian group, Neto et al., look at the stiffening of the arteries, and they used a device and measured the arterial tone in untreated patients with Fabry disease, and then compared the controls among 60 patients with Fabry disease, and about 237 controls were measured. And there were more than half of these patients with Fabry disease have both aortic stiffening and increased femoral pulse velocity. We are moving again to how we can assess the cardiac involvement in Fabry disease. As it has been previously reiterated by the German group, now the UK group is presented by Augusto et al. They suggested using an MRI with late gadolinium enhancement to assess the fibrosis in Fabry disease, and also checking the cardiac biochemical markers that includes high sensitivity troponins, maybe the most accurate and the strongest way to predict the cardiac injury in Fabry disease. And both these groups actually hypothesized the inflammatory changes would be the contributing factor to the cardiac disease that we observe in Fabry disease. Some other groups, the Spanish group, look under the etiopatophysiology of the events that occur in addition to the inflammatory process, and they suggest that the markers of oxidative stress, such as MCT1, which is monocarboxylate transporter 1, actually could correlate with the tissue hypoxia, which occurs in an enlarged heart. And they suggest that this could be a biomarker for Fabry disease cardiomyopathy.